Hello friends, so in this video we are going to see about curriculum development, how the curriculum is designed for a specific population or how the curriculum is to be designed based on the needs of the society and how can we formulate the objectives and how the curriculum can be evaluated once it is implemented, right? So in this video, let us learn about all these aspects collectively, curriculum development. So before we get started, let us understand the meaning of this curriculum development. Curriculum development is nothing but it is a process. What we are doing here is we are selecting, organizing, and executing, evaluating learning experiences based on the needs, abilities, and interest of the students and the nature of the society or community. So curriculum development is simply um, we just proceed with the process of selecting learning experiences, which means the curriculum which is designed for the particular population or the learners. So we are choosing and we are organizing and we are planning for the implementation, and finally we are evaluating it also whether the objectives of the curriculum it is achieved or not. Okay, so that is defined as curriculum development. So in order to have this curriculum, we must have some of the steps or the basic pillars of this curriculum development. It was well explained by Rolf Tyler. So according to him, there are four steps in order to develop any kind of curriculum. One is formulation of educational objectives. Second is selection of learning experiences. Third one is organization of learning experiences. And the fourth one is evaluation of the curriculum. So we start with the educational objectives, and once objectives are prepared, then we are choosing or selecting the learning experiences where the learners are going to get experienced. Then accordingly we are going to organize it in different areas and different places. Then finally we evaluate the curriculum whether the designed curriculum is implemented correctly or not. Right. So these are the four basic pillars or steps of developing any curriculum. Let us see one by one. So let's start with the formulation of educational objectives. So in order to formulate these objectives, we need some of the data because this is the first and a foremost step which we required to develop the educational objectives. So what we are required in the sense, first of all, we should have the philosophical statement of the institute. So what is their philosophy? So every institute must have their own philosophy that is required to proceed with. And secondly, we should understand the societal and health needs of the um, current society. Okay, that is most important. Then we should understand about the students as well, because what are their needs and what the levels of the students. So this also we have to keep in mind while formulating educational objectives. Then resources available in the society. If the curriculum is designed where they are going to get the learning experiences, that the society only decides, right? Then the scope of the program. It is purely if we talk about the BSc nursing or the MSc nursing. So MSc nursing, the options are many. They can go work as a teaching faculty in the nursing colleges, or they can work as a staff nurse in the hospitals. Similarly, BSc nursing staff also. So what would be the scope after completion, after completing the particular curriculum? Maybe the duration is 2 years or 3 years or 4 years, whatsoever the duration is, but what is the scope after the program? That has to be mentioned. Then minimum requirements in terms of clinical and other facilities. So this is already designed by the statutory councils, like for us nursing, Indian Nursing Council and the state nursing councils are already working on it. So that has to be followed. Then the future trends in nursing. So what would be the future, and these are the possible and predictable trends in nursing. So based on that, the objective should be planned and prepared. Then we have the criteria for selection and the statement of objectives. Though while choosing these objectives, the criteria should be followed. One is stated in the form which makes the most helpful in selecting the learning experiences. Um, it is actually the objectives, whatever we prepare, we make sure that it is going to help the students while they are learning something. then it should be attainable and practicable. So practicality and the possibility of this curriculum or the objective should be keep in mind. Then the objective should be contributing to the social needs as well as the social change also. So we understand the social need, accordingly we are preparing the curriculum. Then once the curriculum is implemented, we make sure that there is some social change happens because of the curriculum implementation. Then it should be a motivating factor for teacher as well as students. So for both categories, students as well as teachers should be motivated by the objectives which is prepared. Then again the objective should be accepted and understood by the teacher and the learner, because without understanding the objectives they cannot move further and there won't be any fruitful effect because of the curriculum. Then we have to have the evaluation schemes. I should be well in prepared well in advance and developed. So these are the criteria for selection and statement of objectives. Now, if you want to formulate the educational objectives, we have to follow some of the steps. One is we have to identify the needs of the learner and the society. So, as we seen in the previous slides, in order to create or in order to make some social changes, so we should understand the societal needs first, because we are the part of society. So, learners comes from the society, so we should understand the need of the society. Then the expert suggestions we have to go through. We have to do research on the expert opinions and expert suggestions in order to develop any curriculum. So that also helps us to have a well-designed curriculum. And we have to have the philosophy. Okay, in order to formulate the educational objectives, one institute must have their own philosophy in which way they are going to implement this education. So there are many philosophical approaches are there. So in which philosophical approach the institute wants to convey the curriculum to the learners, that has to be specified. Then state objectives gathered from various sources in a proper way. So this will help us to define each and every objective according to the subject area or according to the learning experience area. Then formulate the theory of learning. So what they are going to do once the curriculum is ready, designed, then implemented, then the learners are actively participating in the learning experiences. Then what kind of learning exposure they are going to get? Okay, that has to be formulated. Then define the objectives clearly in terms of content. So each and every objective should have its own content, what it is going to achieve at the end of the curriculum implementation, because there is a process called curriculum evaluation. We will come to know the changes or the impact of the curriculum which is implemented, that will be understood at the end of the implementation. Then finally, you have to state the educational objectives in terms of behavioral outcomes or change. So what are the possible outcomes predicted or expected from the learner's end, that has to be mentioned very clearly, right? Social change or the behavioral change in terms of outcome, what we are expecting in the learner and what we are expecting that will happen in the society, that has to be stated very clearly. These are some of the steps in the formulation of educational objectives. So with that, we have completed the first step of curriculum development. Moving to the second step called selection of learning experiences. How you choose your learning experiences for the learners. Okay, here it is defined as deliberately planned experiences in selected situations. So we decide that where we are going to place them, and the situation motivates the students to actively participate and interact, and which results in desirable changes of behavior in the students. So it is purely depends on the learning experiences and especially the selection of learning experiences, which gives some fruitful impact in the students behavior or the changes, right? Because it is a situation or it is an opportunity for the students where they are going to actively participate and interact as well, that is going to have some or create some changes in the behavior of the students. Then selection of learning experience is concerned with the decision about the content of subject matter. So again it depends on subject area. Selection of learning experience is purely based on subject area. For example, if you're planning for learning experience in community health nursing, then in that case you have to choose whether a rural community area or urban community area, right? Or nursing foundation, it may happen in the laboratory as well, or it can happen in the medical and surgical wards as well. So selection of learning experience should be very neat and clean and perfect in order to bring some desirable changes in students' behavior. So we have to follow some of the principles when we choose or select the learning experiences for the learners. Okay, so always it is based on the needs in relation to the selected objectives. So we have to keep in mind while choosing the learning experience whether it is matching with the objective or not. Then secondly, um, in relation to those real life situations when the students are expected to practice after qualifying. So though we practice the students in laboratory or in the classroom setup or in the dummies, but still we have to ensure that the students are able to perform it on real life patients as well. Okay. Next is selection should be in a manner that there is an effective integration between theory and the practice. So nursing is a profession where we are teaching the students first to the theory aspect, then we are putting them in the laboratory or the fundamental lab practices where they are practicing all the procedures on the dummies or in the form of ASCII method. Then they will be shifted to the hospital to perform the procedures on the live patients. Okay, so we have to ensure that there is a connection or there is a correlation between the theory and the practice which they have learned. Then it should be selected in such a way that learners are constantly motivated. So there should be an opportunity continuously that the students are learning something always, all the times. Okay. Then the learning experiences selected should be according to the needs of the students. Of course, this is the most important aspect because if there is no need for the student, then the area should be avoided or ignored. Then it should provide some same or equal chances for all the students. So there is no doubt because obviously all the students are going to get same kind of experience. If they are posted in the medical surgical area, then everybody will be getting the same exposure only. So it depends on the students how much effort they are putting to learn the things, to grasp the things. It depends on their motivation and the self-interest. Then it should not be beyond the particular stage of development of the students. So this is they're trying to say that while planning this learning experiences, we have to see in which year they are studying, either first year student, second year, or third year, or fourth year. Okay, so it shows that the development stages of the student. So first year student, we cannot teach about this OBG and other research related aspects. So they are the beginners, they are the novice people. It may take another 2 years to learn all these things. So we have to ensure that the learning experiences are related to their particular stage of development as well. Okay, so next is about some of the characteristics of good learning experiences. So how it should be if it is a good learning experience, it should allow the students to learn by doing. Okay, so this is another philosophy which is selected by the institution. Okay, learning by doing is a best method, and second is it creates motivation and interest among students always. Okay, if it is a good learning experience, it always motivates the students and interest to do something either in theory or in the practical. Then it should be challenging to students, which means it gives some task or it always keep the student busy engaging in some activities or finding the solutions to some kind of issues or the problems. Okay, always it's a challenging one. Then the learning experience should bring out multiple outcomes in students because we are not focusing on only one aspect. So there will be multiple outcomes or multiple impact if the students undergoes in any kind of learning experiences. They understand, for example, we can say while they interacting with the patient, they understand the communication skills and they understand what is empathy and empathy, the qualities of a nurse, and they provide nursing care also. In that way, they develop their skills and they know how to take care of the patients and they follow the principles and other hospital protocols and everything. So there are the multiple outcomes you can expect in one student when they perform one procedure, right? And also it helps students to acquire needed knowledge, skill, and attitude. So everything comes um, from this good learning experience exposure only. So if the learning experience or the area is very comfortable for the student, definitely they learn everything, and it stimulates the student to learn the things voluntarily or by the self-motivated manner they are learning the things, and it changes their attitude as well. Then if it is a good learning experience, then it helps in hunting or gathering information. So always the students or the learners waiting for the new informations, or to they're waiting for the new learning every day to happen in the particular area, if it is in the hospital, or if it is in the laboratory, or if it is in the classroom, right? So it is purely based on how we choose the learning experience, and if we it has the mentioned characteristics, then definitely it is going to create some positive impact among the students. So next, let us see about the criteria for the selection of learning experience. Okay, we have some of the criteria. One is it should be consistent with the philosophy of the institute and lead to the achievement of the objectives. So philosophy, aims and objectives are more important in order to have a well-designed curriculum. Okay, so it plays a vital role in selection of learning experience as well. Secondly, it should be varied and flexible enough. So versatile experience it should provide, and it should be flexible enough that they can learn n number of informations or knowledge they can attain in that particular area. Thirdly, it should be so selected that it will give a student an opportunity to practice the kind of behavior implied in the objective. So the expected outcome should be elicited when the student is exposed to any kind of learning experience. Okay, that criteria we have to keep in mind. So whatever is mentioned in the objectives or the outcome predicted at the end of the curriculum implementation, we have to make sure that it is achieved, or the desirable changes in the student behavior is noted, and it should be adapted to the needs of the students definitely, and learning experiences are planned and evaluated cooperatively by the teacher and the students. Okay, this is commonly understood. Then we are moving towards the third step of curriculum development, organization of learning experience. Now selection of learning experience is over. Now how we are going to organize it? So it has to be done very carefully, systematically and sequentially. So according to Tyler, the primary aim of learning experience in the curriculum is to bring and relate various learning experiences together to produce the maximum cumulative effect in order to give a unified view of the whole, so that the educational objectives are achieved. So it is a collection of all the learning experiences. Okay, what that does, it is produce the maximum cumulative effect that is going to change the behavior of the individual student, right? So continuity, sequence and integration has to be followed while organizing the learning experiences. Again, we have some of the principles to organize this learning experience. One is there has to be organized that succeeding experiences built upon those which preceded. Okay, so there should be continuity as we mentioned earlier. Then in one area and other area should be related to each other. So always there is a connectivity between the learning experiences the students are getting. Then should utilize the allotted time in a cost effective manner. So whatever the time is allotted, it should be utilized properly, and you have to make sure that it is utilized in a cost effective manner, and should be organized in broad areas in order to facilitate relating the learning experience in allied areas. So wherever the connectivity areas are related to the subjects, so all areas should be exposed to the students, and broad principles of education has to be applied and emphasized. And another principle is provide ample opportunities for the student so that the required ability and skills are easily attained. So we have to keep the doors open that a student can learn anything, and whatever the possible opportunities are there, that we have to uh, update the students so that they develop their skills, and that the skills will be easily attained. Then provide opportunity to concentrate on one or more electives. So here there is should not be any restriction that the students can choose any number of electives if they are willing to do so. So that opportunity should be given. Then organized in terms of broad subject matter areas like humanities, behavioral sciences, biological sciences, and nursing sciences. These subject matter are additionally added along with the other major subjects and should be neither too flexible nor too rigid. So this, while organizing the learning experiences, the teacher and the committee should keep in mind. Then assignments should be valued on the basis of experiences provided to the student. So it should be within the limit only. If they are posted in medical wards, then the assignments or the evaluation should be based on only the experiences they have gained in medical areas only, right? It is very limited to that area. So these are the principles of organizing learning experiences. Now let us see the fourth step of curriculum development is called evaluation of the curriculum. So how we are going to evaluate the curriculum? First we have to see the assessment of philosophy of the institution, that we have to start from the philosophy of the institution. Then we have to see the program goals are achieved or not, the nursing content taught in each course, whether it is completed successfully or not, then the course objectives, teaching learning methods, whether it is appropriately used or not, then the course evaluation methods, what they have applied, the teachers, what they have applied to evaluate the course, that has to be seen, then relationship of non-nursing courses to the overall plan of the study. These are some of the areas or the components which we have to keep in mind while evaluating the curriculum. And we have got some principles as well to evaluate the curriculum. One is consisting of uh, finding out to what extent the objectives are being achieved. Because if you want to evaluate the curriculum, you have to start from the first one, formulation of the objectives. Once the objectives are formulated, whether it is achieved or not, that we have to see. Then plan of evaluation should be comprehensive enough to measure adequately the behavior. Okay, then techniques and methods which we are going to use in the evaluation process should be based on the specific behaviors expected and measured. So we know that these are the desirable changes we are already predicted, right? So that we have to expect at the end of the curriculum implementation, and the tools should be related to that one. Then, if the satisfactory evaluation program, if you want to say, then that should include a variety of evaluation tools or measurements. So that is going to give accurate results or accurate evaluation at the end of the curriculum implementation. Okay, so these are some of the principles of curriculum evaluation. And finally, in curriculum evaluation itself, we have to follow 5 M's. What are those 5 M's? One is men. We have to evaluate the faculty, those who are involved in teaching process, including the other personnel also, those who have implemented the curriculum. Okay, we have to start evaluation from those people. Second is money, the financial aspects which is spent towards the implementation of the curriculum. This you can say in terms of purchasing the textbooks or the articles, equipments for the laboratory, whether it is utilized properly or not. This is another kind of evaluation. Third M is about the materials. Materials is we can say that the textbooks for the library purpose, or the journals, or the instruments for the laboratories, or the dummies for the nursing foundation lab, or any other teaching learning materials, okay, which is procured by the management or the institute, whether it is utilized properly or whether it was adequate or not for to provide a wonderful learning experience to the students. This is the third M we have to evaluate. Fourth M is methods. Methods are nothing but the teaching learning methods which we with the faculties have implemented in order to impart the knowledge, right? So the learning experiences, whatever the students have attained, whether it was sufficient, adequate, and the teachers were responsible in providing those things, and the teaching learning methods were appropriate or not, that has to be evaluated in the fourth M. And the final M is about minutes. Minutes here is the time duration, whether it was equal to all the students for all the subjects, whether it was adequate, the theory and the practical hours were sufficient to provide the learning experiences to the students or not. Okay, this is in terms of minutes or duration has to be evaluated. So if all 5 M's are evaluated properly, that is going to give you the result, whether it is successful or it is a failure curriculum, right? So this is all about um, development of curriculum or curriculum development in any institution or any area. So these are the common aspects, right? Thank you.